So every election season, we want you to get to know each candidate's positions on the most pressing issues. Tonight, hearing from the candidates in the gubernatorial race. We asked them what can be done to make sure New Hampshire is prepared for a future pandemic similar to COVID-19.
Well, we're doing it. We have never taken our eye off the ball. The pandemic always evolves. We know that. But with the incredibly fast opportunities that we created in terms of getting the vaccine out in the first place, we know how to get those out rapidly. We have the therapeutics, so if folks get sick, they can literally get in and out of a hospital within a day. People are much more aware in terms of symptoms and managing and monitoring those symptoms. And we have the right teams on the ground. So we worked hard during the peak of the pandemic to make sure that in the long run, we had the infrastructure in place in terms of how to mobilize workforce, how to mobilize the National Guard. God forbid it should come to that. But I think we're in a good place to manage, and people can kind of maintain their everyday lives. They're much more aware. Everyone's, I think, a little smarter about how to go about it, especially in the peak seasons of the fall and the winter. So I feel very confident this is very manageable as we go forward.
It's a great question, because one of the things we're not really doing, that is something that we always do in the medical community, is go back and say what went right, what went wrong. We need to make sure that we understand exactly where we were when COVID hit and what it took to actually respond, and make sure we're never caught behind again in the future. We learn from that. We build out that network. We make sure it's ready to go, whether it's having enough PPE, whether it's having a rapid response force for another pandemic. It's not a matter of if, it's a matter of when we face this again. We have to learn from those mistakes. That's the way we do it in healthcare. That's the way we do it in public health. That's the way we need to do it in the Granite State.